Aqueous humor. Aqueous humor is a thin, clear liquid that fills the space between lens and cornea. It is produced in the ciliary body by ultrafiltration and active transport from plasma at the rate of 2 cubic millimeters per minute. It flows through the pupil and fills the anterior chamber of the eye. It is normally reabsorbed through network of trabeculae into canal of Schlemm and uvous scleral outflow, the venous channel that at the junction between iris and cornea. Refractive index of the aqueous humor is 1.336 and pH is 7.1 to 7.3. The space between the lens and cornea is divided into anterior and posterior chamber by iris. The space between iris and cornea is anterior chamber. Space between iris and lens is posterior chamber. Both the chambers are filled with aqueous humor and they communicate with each other through the pupil. Functions. It helps in the maintenance of normal intraocular pressure. It is the second medium of refraction. It provides nutrition to the cornea and lens and takes place the lymph as it is absent in the eye. Aqueous humor contains proteins, electrolytes, that is mainly sodium, potassium, bicarbonate and chloride, and non-electrolytes like glucose, urea and uric acid, organic acids like ascorbic acid, lactic acid and hyaluronic acid, and dissolved oxygen. Mechanism of formation of aqueous humor. Mainly ultrafiltration and some amount by active secretion. If you see the circulation of the aqueous humor, it is formed from the posterior chamber by ciliary processes. Then it enters into from the posterior chambers through the pupil to the anterior chamber, then enters into the canal of Schlemm at the limbus, and then to episcleral venous plexuses. Circulation is necessary for both metabolic processes and to regulate the intraocular pressure. Any disturbance in the normal flow may increase the intraocular tension, leading to glaucoma. Glaucoma is a degenerative disease in which there is loss of retinal ganglia cells. Obstruction of the canal of Schlemm leads to increased intraocular pressure. Increased intraocular pressure does not cause glaucoma, but it worsens glaucoma. There are two types of glaucoma, that is open angle glaucoma and closed angle glaucoma. Open angle glaucoma, here the cause of increased pressure is decreased permeability through the trabecular meshwork, through which the aqueous humor is drained. Wherein angle closure glaucoma, here there is a forward movement of iris which obliterates the anterior chamber angle, that is the angle between iris and the cornea, thereby block the opening of trabecular meshwork at the angle. Normal intraocular pressure is 10 to 21 millimeters of mercury. Pressure in venous plexus is around 10 to 15 millimeters of mercury. This difference helps in continuous drainage of aqueous humor to venous plexuses. Two important factors maintaining normal intraocular pressure are rate of formation and rate of reabsorption.